My name is Dr. Munir. I did my anesthesia training from University of Arkansas and I did my pain fellowship from Harvard. I am currently practicing as an anesthesiologist in Ohio and also as a pain management specialist in Ohio. The reason I made this video is because I've realized that there is a severe shortage of the special kind of mask which are called the N95 mask. I want you to follow me so I can tell you what exactly is the situation. These are the N95 masks. They come in different shape and forms, but these are in fact especially meant to seal the face around your nose and mouth. So when you breathe, you can in fact filter really small particles, especially the virus. This coronavirus is not in fact an airborne disease otherwise, to our understanding. However, when we are doing certain procedures for the patients who may have coronavirus or who are in fact diagnosed with coronavirus, uh, the virus can get aerosolized, which basically means it can become in the small particles that we can breathe and can get that infection. That makes it very critical for the doctors, nurses, the ER doctors who are dealing with these patients to have an ample supply of N95 mask. So I want you to know that how the doctors and nurses and CRNAs and all of us are feeling right now. We feel scared, and we're not scared because we have to take care of the people who are sick or who come with disease that we can get, but we are scared because we do not have equipment to protect us. I want you to also see that the total number of anesthesiologists are about 35,000. Yes, I'm correct, 35,000 in the whole United States. We have about the same number of CRNAs who are the nurse anesthetists, and we work hand in hand, which make us anesthesia providers. So these are about 70,000. Then we have ER docs who are about 40,000. We have total number of internal medicine doctors who are about 114,000. We also have respiratory therapists who are about 100,000. And if you include all the nurses, all registered nurses, they're about 2.8 million. The reason I'm giving you these numbers is to have you understand that the people who need these are not in that big number who are going to be dealing with these and who are currently dealing on the forefront with the patients who have active corona disease. I want you to also realize that N95 mask is expensive. Let me tell you exactly how much it costs. 20 pack of these masks usually cost $13. Yes, $13. Right now, just because it's shortage, there are people who are selling it in black and in for $6 to $12 for one mask. And it wouldn't have been a problem if we could in fact get it from them. The issue is that I was given this one mask, and similarly is true for most of the anesthesiologists, and have been told to use that as long as you can continue to reuse it. And if we feel that this is in fact not working, then we should ask for a second one because we are either conserving or short of supplies. I want you to know again that we are only 70,000 anesthesia providers. And you can well imagine about the rest of the doctors. I was told by one of my friends who is the president of a local hospital here that he should use a bandana to cover his face because this is the CDC's new guidelines that if you cannot find masks, the doctors should use a bandana to cover their faces. I want you to also know, this is, don't take it like anything other way, but this is a war against that virus, and we are your frontline soldiers. You are sending the anesthesia team, consider them as your SEAL Team 6 or your Marines. You are sending us, telling us that we do not have N95 mask enough to use it whenever we need it, but to use it and reuse it, not knowing if they're still working when we would be in fact dealing with these patients. Then we have our infantry, and we have other soldiers, which are our basically every doctor in that setting who every nurse who wakes up in the morning and go to the hospital and may be told that they don't have enough of not just N95 mask, but the regular mask either. And I want you to know that this is a very unprecedented situation. If I keep the same example of Marines or soldiers, the code of conduct for Marines is that the leaders lead from the front. They don't sit in their offices like our hospital administrators, our politicians, or our commander in chief, and tell us to go fight a war and not have just the basic protective equipment. I want you to know that each individual anesthesiologist or anesthesia provider or a pulmonologist or ear doc, when he gets sick, it's not just that his life is getting compromised, but there are at least 200 to 300 patients who potentially he would be saving that won't be able to save. I also want you to ask at this time that I want our leaders to become leaders and not be bosses. In the situation like this, in crisis, the countries, the groups who succeed, who have leaders, not the bosses. I want all of our administrators, politicians, congressmen, senators, and our commander-in-chief to just cover his face with bandana and at least just once, even for 10 minutes, to come to ER once a day. It will make me feel comfortable that it's okay if they are our leaders and they don't have masks and they're taking this effort to come to the ER once a day for just 10 minutes. I will feel comfortable going to my job. But I want you to understand that if this is just a business, and for that reason, if doctors will start thinking that way and they will decide to not risk their lives, not risk their families, and decide to quit, I want you to understand that they wouldn't be too wrong. So I'm hoping that this message gets enough and clear to the people who are making decisions, and they are not hoarding it. Because every place that I've tried to see that if I can get personally masks for myself and my friends and my family, and I call the people that I work with in my family, I have been told that they've been selling these masks to the hospitals in amounts of 50,000 and 10,000, and we are being told that they don't have enough masks. I hope that this message resonates enough and we can get this problem addressed. Thank you very much.